Now first we'll see what is present over here, and then we'll go downwards. Okay, now as you are going downwards, at that time you will notice that structural changes are taking place. Okay, the size also changes, that means the diameter reduces. See the diameter over here and see the diameter over here. Okay, that means the diameter is also reducing. Along with that, structural means the layers which are present, in those layers the changes are taking place. Okay, followed by the changes taking place in the epithelial lining also. So in the trachea we have seen it is respiratory epithelium. What is respiratory epithelium? Pseudostratified ciliated columnar epithelium. Okay, once you will reach the alveolar sac, can you guess which type of epithelium is present over here?
Squamous.
Simple squamous epithelium. Okay, so in between the transition is taking place. That means pseudostratified ciliated, then ciliated columnar, then non-ciliated, then simple cuboidal. Like this the transition is taking place as you are going downwards. Okay, and ultimately we will be getting the simple squamous epithelium. Now along with that, a special type of cell is also present, okay, in the alveoli. I hope you remember, that is type 2 pneumocytes, which produces surfactant. Okay, that also we have discussed, and I have shown you a diagram where different types of cells are present in the respiratory tract, lower respiratory tract. Okay, now here what we have to study mainly is the structure of bronchus and the structure of bronchiole, and then the difference between bronchus and bronchiole. Because under the microscope you have to identify and then you have to differentiate between bronchus and bronchiole. Okay, so mainly we have to see that. So here you can see the terminal bronchiole. Okay, I am not explaining about the tracheobronchial tree, already we have done. Okay, so just see once over here, the terminal bronchiole, as you can see, it is dividing into respiratory bronchioles. Okay, now this respiratory bronchiole is the smallest bronchiole. So when you will study the bronchiole, at that time you will see that different bronchioles are there, and the division is done based on their diameter. Okay, division is done based on the diameter. Okay, next another important part is there, that is, in case of trachea you have noticed that along with the lining epithelium, which cells are present? Along with the lining epithelium, which cells are present? Goblet cells are present, which secretes mucus. Okay, but in this particular case, the respiratory bronchiole, okay, if you see the respiratory bronchiole or the terminal bronchiole, along with the lining epithelium, you will not get goblet cells. Those cells are replaced by cells of Clara. Cells of Clara or Clara cells. They also produce surfactant. Okay, which will reduce the surface tension, or else what will happen, whenever the air, once it is going, okay, at that time the collapse of the bronchiole can take place. Okay, so this surfactant is preventing the collapse of the bronchiole by secreting the surfactant. That is the main function of the Clara cells or cells of Clara. That is one important, you can say, transition in this particular part. Those cells you can't see in the larger bronchioles. Okay, that can larger bronchus, that can be only seen in the terminal bronchiole and the respiratory bronchiole. Here this thing already we have discussed. What are the changes you can notice? That means first of all, in the trachea we have seen C-shaped ring of cartilage is there, right? So from trachea, two principal bronchus are there, and then it will enter the lung. Once it is entering the lung, then they are called as intrapulmonary bronchus. Intrapulmonary means inside the lungs. That's why they are called as intrapulmonary bronchus. So if you see the structure of the intrapulmonary bronchus, at that time that C-shaped hyaline cartilage is not C-shaped. These are in the form of broken plates of cartilages. Not complete cartilage, broken plates of cartilages are there. That point is very important. Okay, because see, during the time of exam, itna kuch yaad nahi rehta hai, whatever I have discussed. Okay, so the main point which you have to remember is, in order to identify the bronchus and bronchiole, in case of bronchus, you have to see the broken pieces of cartilages, hyaline cartilage. Okay, in case of bronchioles, those hyaline cartilages will be absent. नहीं रहता है bronchioles में. Instead of that, more amount of smooth muscle fibers will be there. Okay. Next, I hope you have heard about asthma, everyone. Asthma. Okay. Now, why the asthma occurs, that we have discussed. Okay. See, I have mentioned over here that, and this asthma is occurring because of the structural changes which are taking place in the bronchioles. Okay, so cartilage wall in the bronchi become irregular in shape and are progressively smaller, and cartilage are absent in case of bronchioles. Okay, in the bronchioles you can't see cartilages. Instead of that, smooth muscle cells are present. Okay, next, the amount of muscle in the bronchial wall increases as the bronchi become smaller. As the bronchi will become small, more number of smooth muscles will be added. Okay. Next, the presence of muscle in the wall of the bronchi is having a important clinical significance, that is nothing but the asthma. Okay, because when there is inflammatory changes taking place, at that time the muscle will constrict. As a result, the passage will become narrower. Once the passage become narrower, the person will feel difficulty in breathing. That is nothing but this asthma. Okay, so whenever, I hope you have seen patient taking inhaler. Inhaler में क्या रहता है? Any idea? Very good. Bronchodilator is there. Okay. I'll give a name of the compound which is present. That is called as salbutamol. Have you heard about it? You have heard salbutamol. Huh? Yeah, inside cough syrup is there, but inside the this one, what to say, inhaler, very commonly occurring ingredient of inhaler is salbutamol. Other steroids are also given, but mostly you will see salbutamol is given. Okay, it is a potent bronchodilator. So once the smooth muscles are constricted, okay, because of the spasm, when you are giving the bronchodilator, it will dilate. As a result, the passage which is there, it will become normal, so that the patient can breathe easily. Okay, and during inhaler, it is going and acting on the muscle directly. It is not mixing with the blood. Okay. In other route, for example, oral route, if you are taking, first it will go to the blood, it will mix with the blood, it will go to the liver for metabolism. After that, it will go to the target organ. Okay, the long process is there. You will study all those things in pharmacology, pharmacokinetics. Okay. Next, along with the changes in the wall of cartilage, some other changes are also there. For example, subepithelial lymphoid tissue increases in the quantity as the bronchi becomes smaller and glands become fewer. Glands means which are present in the submucosa. Okay, those glands become very few. That means the number of glands reduces as you are going downwards. Okay, towards the bronchioles, and mostly the glands are absent in the walls of the bronchioles. Okay, so I hope in the trachea you have remember I have shown you the glands in the submucosa, serous and mucous glands. Same thing you will see that in case of bronchiole these are absent. Bronchioles में नहीं रहता ये सब, these are absent. Okay, why I am mentioning, because this can be seen under microscope. Okay, so please note that point. Next, the lining epithelium. First, in the larger bronchi, pseudostratified ciliated columnar epithelium. Okay. Next, if you go downwards, then epithelial changes to simple ciliated columnar. Okay. Then non-ciliated columnar, and finally cuboidal in respiratory bronchioles. Okay. So this is the transition which is taking place. And then the walls of the alveolar duct are lined by flattened or squamous epithelial cell. Okay. That also can be seen under microscope, this compound microscope. Okay, so these points are important. Okay, when we will see the slide one by one, all these points you have to identify. Okay, next here you can see the comparison between the bronchus and the bronchiole. Okay, so here I have taken the intrapulmonary bronchi, means when after a division the two principal bronchus, when it is entering the lung, then they are called as intrapulmonary bronchi. Okay, so here you can see now there is a difference. जो intrapulmonary bronchi होता है, if you see the layers of the intrapulmonary bronchi and if you see the layers of the trachea, they are not same. Some differences are there. Can you notice the difference? The layers of the trachea, I know you have studied the layers of the trachea, you have drawn the diagram in a practical notebook. ठीक है, तो जो layers of the trachea होता है and the layers of the intrapulmonary bronchi होता है, उसमें थोड़ा differences है. Some differences are there. Just see the difference. Smooth muscle layer is present in trachea also. Trachealis muscle. Arrangement. See the arrangement. So that's why what you have to do, you have to know about the layers of the trachea first. Okay, it should be there. What are the layers of the trachea? Then only you can compare. So see, first mucosa is there. So mucosa में क्या रहता है? Nothing but the lining epithelium is there. Okay, so here you can see the lining epithelium, and below the lining epithelium lamina propria as usual. ठीक है. Next layer you can see smooth muscle is there, not submucosa. Okay, next you can see smooth muscle layer is there, spirally arranged smooth muscle fibers. Next submucosa is there where loose connective tissue, along with that seromucous glands are present. ठीक है. Next, after submucosa, last layer is the cartilage layer. Previously, in case of trachea, we have seen cartilage and muscle layer. Same layer, cartilage and muscle is present. Cartilage is present anteriorly and laterally. Posteriorly, muscle is present. But यहाँ पे ऐसा नहीं है. Okay, here you can see first the smooth muscle layer is there. Okay, after that the submucosal layer, and then lastly we are getting the cartilage. That also cartilage is present in broken plates, not complete C-shaped ring. Okay, so this is the intrapulmonary bronchi, structure of the intrapulmonary bronchi. Next, in case of bronchioles, you can see no cartilage, no seromucous gland. So first, when you will see the bronchiole, what you have to identify? First, you have to identify whether cartilages are present or not, and then you have to see on the submucosa whether seromucous glands are present or not. Okay, these are the most important striking feature. From there, you can identify whether it is bronchus or bronchiole. Okay. Next, depending on the diameter, as I said, different types of bronchioles are there. Okay, as it is going downwards towards the alveoli, the diameter reduces. The diameter will become less. So here only 3 layers are present. That is, mucosa will be there, smooth muscle layer, and connective tissue layer. Okay, but there is one point. There is a twist. What is the twist? In case of mucosa, okay, larger, medium, terminal, respiratory, some changes are there. Okay, what are those changes? The changes are mainly taking place in the lining epithelium. Okay, the changes are taking place in the lining epithelium. Now, last time when you have seen the trachea, okay, at that time in 40x, I have zoomed the slide in 40x, and then you have identified the cilia. Do you remember? Yes. यहाँ पे क्या होगा? When you will zoom the respiratory bronchiole under 40x, okay, you won't be able to see the cilia. Cilia will not be there. Okay, so see, first ciliated columnar epithelium is there, then simple ciliated columnar epithelium, then in case of terminal it is less than 1 millimeter, that is simple cuboidal epithelium. Here also simple cuboidal epithelium, but it is less than 0.5 mm. So in most of the cases I have seen under microscope, this is very difficult to see, this particular layer, respiratory bronchiole. Okay, but you can see the terminal bronchiole. Terminal bronchiole दिखाई देता है. Okay, I have seen over here and I can show you. But ये बहुत difficult है. We have to search under 40x in order to see the respiratory bronchiole. So what is this? Anyone? Yes. Intrapulmonary bronchus, and this is the terminal bronchiole. Now in terminal bronchiole and intrapulmonary bronchus, can you identify the differences? First, what you will see? Over here, what you will see? Cartilage, very good. Can anyone identify where are the cartilages? Broken plates of cartilages? Okay. So can you see the broken plates of cartilages? ठीक है. So if you go from interior to exterior, all the layers, first you can see this is the, what is this? Mucosa. क्या रहता है इसमें? Lining epithelium. ठीक है. Then here you can see the lamina propria. ये देखो, this is the lamina propria. After that, which layer is this? Smooth muscle layer. ठीक है. Beyond that, you can see this is the submucosa. Can you see the glands? Can you see the glands? Okay. External to this, you can see the broken plates of cartilage. Done. This you have to identify. Next, over here, what you can see? See, first you can see the mucosa. Okay, where lining epithelium can be seen. See, the lining epithelium can be seen. Okay. After that, you can see this is the smooth muscle layer. So here, the amount of smooth muscle cells are more as compared to this one. Okay, this is the bronchiole, and here you can't see the broken plates of cartilages. Next, if you go to the submucosa, okay, if you go to the submucosa, you can't see any of the, what to say, seromucous glands. Those glands are not there. These are absent. Moreover, you can see the diameter is also less as compared to this one. ठीक है. So these are the things you have to identify. Up to terminal bronchiole, it can be seen easily under microscope. Beyond that, it can be seen, but it is difficult. I am talking about respiratory bronchiole. Okay. Next, another thing which is also visible, that is the alveoli and the alveolar septum. Okay, alveoli and the alveolar septum are also visible. ठीक है. So what do you think? What will be the appearance of the alveoli and alveolar septum? Any idea? ये देखो ऐसे दिखाई देगा. ठीक है. So here like this kind of view you can see under the microscope. So this is the intrapulmonary bronchus. Okay, these are the terminal bronchiole. Here one terminal bronchiole is there. Here also one terminal bronchiole are there. Now respiratory bronchioles, as I mentioned, these are very small. Okay, though this is a schematic diagram, that's why it can be seen easily. But under microscope it's quite difficult to identify. But still we'll try. Okay. Next, can anyone tell me where are the alveoli over here? Can you see the alveoli? यहाँ पे दिखाई दे रहा है कि नहीं? हाँ. Okay, so these are the alveoli. ये देखो, these are the alveoli, and these are nothing but the alveolar septum. दोनों alveoli के बीच में जो रहता है, these are the alveolar septum. Connective tissue रहता है. ठीक है? तो clear? These three things you have to identify under 10x and 40x. So that is the histology of lung. Next, we'll go to the blood vessel. Now, if you want, you can note it down. These are the differences between the bronchus and bronchiole. Okay, bronchus and bronchiole difference. And in practical notebook, whenever I am showing a chart where all the important points are there, I am expecting that you should write in the practical notebook. ठीक है. जो प्रैक्टिकल नोटबुक तुम लोग सबमिट करते हो, इन दैट व्हेनेवर दिस काइंड ऑफ चार्ट्स और टेबल्स आर देयर, आई एम एक्सपेक्टिंग दैट यू विल बी राइटिंग ऑल दोस थिंग्स. ओके, सी व्हाटएवर वी हैव डिस्कस्ड, यू कैन रिवाइज कंप्लीटली अबाउट ब्रोंकस एंड ब्रोंकियोल विद इन 2 minutes or in 1 minute by looking at the chart. These are extremely helpful during the time of exam. Last minute revision, practical exam से पहले last minute revision, this will help you. Okay. Now you have studied, where you have written you also don't know. That's why I am telling you repeatedly that write all those things in the practical notebook. Okay, in case of alveoli, as I said, mainly two types of cells are there, pneumocyte 1 and pneumocyte 2. Okay, pneumocyte 1 is nothing but the simple squamous epithelium where gaseous exchange are taking place. Pneumocyte 2, special type of cell which secretes surfactant. Okay, prevents the collapse of the alveoli. Okay, and along with that some brush cells are also there, that already we have discussed what are the brush cells and what are the important functions of the brush cells. Okay, now here you can see this chart is also important. Why? Because in the respiratory tract, lower respiratory tract, different types of cells are there, starting from the trachea to the alveoli. Okay, now all the cells are mentioned over here. Okay, that's why this kind of charts are very important, and from now onwards you have to mention or you have to write about all those things in your practical notebook. Don't forget. ठीक है. तो ये देखो, from in case of trachea, bronchus and alveoli, okay, what are the cells present, everything is mentioned over here. Okay, and along with that their functions also. And I have seen most of the students have drawn this diagram. Okay, you have drawn this diagram. It's very good that you have drawn this diagram. At least you can see what are the different types of cell present throughout the lower respiratory tract, starting from the trachea to the alveoli. This also you have to draw practical in the practical notebook. ठीक है, ये भी draw करना है ये diagram. Okay, now let's go to the blood vessel. Now in case of blood vessel, you know that 3 coats or 3 layers are there, that is tunica intima, tunica media and tunica adventitia. Any blood vessel if you take, artery, vein, you will be getting these particular layers. But in case of artery or in case of vein, the thickness of the layers, it differs. Okay, in those particular 3 layers, what is present that you have to know. First, tunica intima, as you can see endothelium is there. Now what is this endothelium? It is nothing but the simple squamous epithelium. ओके, जो एंडोथेलियम है, इट इज सिंपल स्क्वामस एपिथेलियम. एंड प्लीज नोट दैट जो एंडोथेलियम होता है इन द लुमेन ऑफ द ब्लड वेसल, दैट इज लाइंग ऑलवेज पैरेलल टू द फ्लो ऑफ द ब्लड. ब्लड वेसल है, suppose one blood vessel is there. Now the lumen of the blood vessel is lined by endothelium. Endothelium is nothing but the simple squamous epithelium. तो उसका जो ओरिएंटेशन होगा, that is always parallel to the flow of the blood vessel. okay, or else it will provide resistance to the flow of the blood. Blood can't flow easily. That's why it is parallel to the flow of the blood. Next, subendothelial connective tissue is there, where loose connective tissue is present. Then internal elastic lamina, that is mainly made up of fenestrated elastic sheets, means fibers of elastic sheets are present in that particular layer. Then tunica media is there, where smooth muscle fibers are there. Now arrangement is not same, it is different. It is concentrically arranged, spirally arranged, okay, and they also produce collagen fibers and elastin. Along with that, the fenestrated sheets are also there, and that particular fenestrated sheets which are present in the tunica media, they form the external elastic lamina. Okay, so if you want to differentiate between the layers, ठीक है, तो जो internal elastic lamina होता है and external elastic lamina, दोनों के बीच में tunica media रहता है. Internal elastic lamina के ऊपर रहता है tunica intima, और external elastic lamina के नीचे रहता है tunica adventitial. Okay, like this you can try to understand about the layers. 3 layers are there, ठीक है. तो जो 3 लेयर है, दोनों के बीच में, 3 लेयर के बीच में 2 sheets of elastic fibers are there. Okay, just near to the tunica intima, that is called internal elastic lamina. Near to the adventitia is external elastic lamina. दोनों के बीच में जो लेयर रहता है, what is this? Tunica media. Okay, above that tunica intima, below that tunica adventitia. As simple as that. Now, जो tunica media होता है, mainly it is made up of, as I said, smooth muscle fibers are there, and along with that elastic fibers are there. Okay. Now, when you will study about the elastic artery, at that time you will come to know that the elastic fibers are more in case of tunica media. Smooth muscles are there, but more number of elastic fibers are present in case of elastic artery. Muscular artery में क्या होगा? उल्टा होगा. That means more number of smooth muscle fibers are there as compared to the elastic sheets or the elastic fibers. ठीक है? And then in case of tunica adventitia, fibroblasts are there, collagen fibers, elastic fibers, vasa vasorum, nervi vasorum, all those things are present. Do you remember about vasa vasorum, nervi vasorum, which we have discussed earlier? Okay, so this is a 3D diagram showing a structure of artery, okay, blood vessel. So here you can see all the layers. You can see the tunica intima, the innermost layer. Then you can see the tunica media, and then you can see the tunica adventitia. Okay, most of the cases tunica adventitia जो है उसमें collagen fibers रहता है. Along with that, some elastic fibers are also there. Okay. Now, can you see the blood vessels which are coming like this? These are nothing but the vasa vasorum, nervi vasorum. Okay. So these are supplying. If you see the blood vessel, okay, जो blood vessel होता है, now inside the blood vessel, blood is flowing. Okay. Now when the blood is flowing, this particular area is getting blood directly, which is present inside the blood vessel. Now this particular area, which is the outer part, how they will get the blood? For that, vasa vasorum are there. That means the blood vessels which are arising from inside, they will come and then they will supply the blood to the outer part of the blood vessel. That is called the vasa vasorum. When you have studied the coronary arteries, okay, when you have studied the coronary arteries, at that time you have not studied the peculiarities of the coronary arteries. क्या है peculiarities of the coronary arteries? See, we know that heart is supplying blood to the entire body, but heart itself needs blood supply to function properly. Okay, for that the coronary arteries are there, which are supplying blood to the heart. So they are nothing but the vasa vasorum of the heart. अभी समझ में आया? Okay, next. In artery, 2 types we have to identify, that is the elastic artery and the muscular artery. ठीक है? तो how you will identify which is elastic artery, which is muscular artery? Any idea? तीनों layers will be there, 3 layers will be there. That means tunica intima will be there, tunica media will be there, tunica adventitia. Same in case of muscular artery also. But what do you think? What will be the difference in case of elastic artery and in case of muscular artery? Yes, so first of all you have to focus on the tunica media. Okay, first you have to focus on the tunica media. So mainly the differences are lying on the tunica media. Okay, now here elastic arteries are also called as conducting blood vessel. What is the meaning of conducting blood vessel? That means from heart it will conduct blood to the various part of the body. ठीक है? Muscular arteries are also called as distributing arteries. That means what they will do, they will distribute that blood into the tissues, into the organ, into the structure. That's why they are called as distributing arteries. Okay. So in case of elastic artery, they are also called as conducting blood vessels. So 3 layers. Okay. As I said, common. ये 3 layers common है. But some changes are there. What are those changes? First of all, endothelium is there. Subendothelial connective tissue will be there. Along with that, internal elastic lamina is also present, but it is not prominent. Okay, so this is one important point. Please note it down. जो internal elastic lamina होता है, in case of elastic artery, it is present, but it is not prominent. What is the meaning of this? Prominent नहीं है मतलब it will be very difficult to see the internal elastic lamina. Okay, but in case of muscular artery, this is prominent. You can see the internal elastic lamina. Okay. These are the differences. So difference has started. Note it down. Next, tunica media, many layers of smooth muscle fibers will be there. Okay, multiple layers of fenestrated elastic lamellae will be there. Now, what is the meaning of this? That means elastic fibers are there. That also in the form of lamellae. That means in the form of sheets. So sheets of elastic fibers will be there. In between the sheets of elastic fibers, the smooth muscles are placed. Okay. That means more number of sheets of elastic lamellae will be there. In between them, smooth muscle fibers will be present. ठीक है? That is the structure of tunica media in case of elastic artery. Next, if you see the tunica media of the elastic artery, it is thickest among these 3 layers. 3 लेयर है. 3 लेयर में सबसे ज्यादा थिक कौन सा है? थिकेस्ट. दिस इज द टूनिका मीडिया. दिस इज ऑल्सो इंपॉर्टेंट स्ट्राइकिंग फीचर और आइडेंटिफाइंग फीचर फॉर द इलास्टिक आर्टरी. नेक्स्ट, इन केस ऑफ टूनिका एडवेंटिशिया, इट इज रिलेटिवली थिन. It is very thin. Okay, easily it can be differentiated. Okay, relative longitudinal collagen fibers are present. And in most of the cases I have seen, though it is very thin, that's why when the slide is prepared, तो क्या होता है, इस layer से अलग हो जाता है. Okay, some part used to get separated, so easily it can be identified, the tunica adventitia. Okay, not in all slides, in some slides. So I hope it is clear about the elastic artery. Now this is the schematic diagram, drawable diagram, which you have to draw in the practical notebook. ठीक है. Now here you can see the endothelium. ये देखो, this is the endothelium. Okay. Now below the endothelium, subendothelial connective tissue are present. Okay. जहाँ पे subendothelial connective tissue खत्म होता है, means the area where the subendothelial connective tissue ends. In that particular part, you will see the internal elastic lamina. Internal elastic lamina, and as I said, internal elastic lamina is indistinguishable, means it is not prominent in case of elastic artery. So here, can you see the internal elastic lamina? Can you see properly? No, it is there, but it is not prominent. Though it is not prominent, that's why it cannot be seen properly. But ये रहता है, ये जो particular area है, ये this one, यहाँ पे है internal elastic lamina. Okay. Now can anyone tell me, ये जो internal elastic lamina repeatedly I am mentioning, ये ठीक से क्यों दिखाई नहीं देता है? Any idea? Yes, yes, very good. Because of the stain. Elastic fiber के लिए special stain होता है. If you stain with special dye, then only it can be visible. That is oracin stain. Here H&E stain. So after, with the help of H&E stain, elastic fibers are not clearly visible. Okay, that is the main point. So if you use different stain, then elastic lamina will be visible. ठीक है. तो see, this entire part is tunica media. Now in the tunica media, can you see these are the sheets of elastic fibers, and in between can you see the nucleus? So these are the nucleus of the smooth muscle cell. Okay, तो जहाँ पे nucleus है, just think that this is nothing but the smooth muscle, because we have studied smooth muscle spindle shaped रहता है. ठीक है, centrally placed nucleus. तो यहाँ पे जो nucleus दिखाई दे रहा है, these are nothing but the nucleus of the smooth muscle cell. Okay, and you can see they are placed in between the sheets of elastic fibers. Okay, elastic fiber में nucleus दिखाई नहीं देगा, so you can't see any nucleus over there. ठीक है. Next, just see the thickness. Okay, this is entirely made up of tunica media. And now this particular part, okay, this is the thinnest one. This is the tunica adventitia. Okay, the thinnest part. This is a histological diagram of elastic artery. Okay, this is under low magnification, this is under high magnification. So here you can see this is the lumen, where you can see the lining epithelium. After that, this entire part is nothing but the tunica media. Okay, so just see the thickness of the tunica media, and just see this is the tunica adventitia. So as I said, in most of the cases you will see tunica adventitia, though it is very thin, it is separated from the layer. ये देखो separate हो गया है. Next is the muscular artery, or also called as distributing vessel, which distribute bloods to the various organ or various tissues of the body. Okay, best example is femoral artery. You have studied about femoral artery, that's why I am giving that example. Femoral artery is an example of distributing blood vessel. Now here you can see same three layers will be there, but what are the differences? Endothelium is there. Here subendothelial connective tissue is present, but it is very less. Okay, subendothelial connective tissue is less. Prominent wavy internal elastic lamina. Okay, तो यहाँ पे internal elastic lamina है. In previous case it was there, but here it is prominent. Okay, so this is one important identifying feature of the muscular artery. Okay, next if you go to the tunica media, it is thick. More smooth muscles are there as compared to the elastic fibers. Elastic fibers are present, but the quantity is less as compared to the smooth muscle fibers. Okay, next, external elastic lamina may be present, means it is present but it is not prominent in this case. Next, tunica adventitia, it is relatively thicker than the elastic arteries. Okay, यहाँ पे जो tunica adventitia है, it is relatively thick as if you compare with the elastic artery. In elastic artery we have seen tunica adventitia is very thin, but here it is thicker as compared to the elastic artery. Now here you can see the diagram. This is the schematic diagram which you have to draw in the practical notebook. So see, this is the endothelial lining. After that you can see subendothelial connective tissue is present, but it is very less. Okay. Next you can see the internal elastic lamina. Actually in this particular part internal elastic lamina will be present. Okay, and this entire part, ये देखो यहाँ पे internal elastic lamina रहेगा यहाँ पे. Okay, now in this particular part is the tunica media. Now here you can see the thickness of the tunica media is less as compared to the elastic artery, and then you can see this is the tunica adventitia. So tunica adventitia is thick, okay, as compared to the elastic artery. So these are some important identifying feature. With the help of this you can identify the muscular artery and the elastic artery. Okay, now this is the original histological diagram. Okay, now in this diagram you can see this part is the medium sized artery, this is the vein. So just ignore this particular part, focus on this area, because this is the appearance which you can see under microscope. Okay, so all the layers can be visible. You can see the tunica intima, this is the media, and you can see this is the externa or adventitia. No. This is for identifying under microscope. For drawing this diagram, see, every time I am mentioning which diagram you have to draw and which is for your understanding. So please note that. Okay, this is also important. So please write it in the practical notebook, the differences between the elastic artery and muscular artery. Okay, and don't forget to write about the examples. Okay, next about the veins. Okay, so same in case of vein also, those three layers will be there. Okay, all those three layers are. Now in case of veins, what Now in case of veins, what exactly you have to know? First of all, the classification. Okay, so based on the diameter, as you can see, the smallest one is the venules, then small vein, medium sized vein, and the large veins. Okay, these are the classification done based on the diameter. Okay, now all the three layers are present. So if you see the venules and small veins, first of all, these are the smallest veins. The venules are the smallest veins of our body. Okay, what they will do, they will collect the blood from the capillaries. The walls of the venules, especially, they are present at post capillary venules. Considerable permeability is there. Why? Because they allows the exchange between the blood and the surrounding tissue. Okay, so when the blood is flowing through them, they will allow the exchange of the material. The venules are the sites which lymphocytes and other structures can pass from the bloodstream. That means if you see the example of lymph, okay, whenever they are flowing through the venules, at that time the lymphocytes or the other cells which are present in the blood, they can escape from that particular blood supply, and then they will enter into the intracellular spaces. Okay, now in case of venules, the diameter is less than 0.1 mm. Next, venules are also two types: post capillary venules and muscular venules. Okay, here the diameters are variable. Okay. Next, in case of large veins, all three layers are present. Okay, as you can see, tunica intima is there, media, tunica adventitia, and these are well differentiated. Next, the tunica adventitia is always thicker than the tunica media. So, in case of vein, ulta hota hai. Previously, we have seen in case of elastic artery, tunica adventitia is very small, very thin. But in case of larger vein, ulta hota hai. That means tunica adventitia is very thick as compared to the tunica media. Okay, that is how you can identify the larger vein. Okay, example is IVC, SVC. These are the example of large veins. Now the wall of the large veins have some elastic tissue, resist the pressure. Okay, from the right atrial systole, inferior vena cava, superior vena cava, etc. Medium sized vein, they are also having all three layers, but it becomes gradually difficult to distinguish these three layers. Okay, in case of medium sized vein, the example are splenic vein, testicular vein, etc. Three layers will be there, but it will be difficult to distinguish between the three layers. Now in case of medium sized vein, tunica intima, endothelium is there, basal lamina, subendothelial connective tissue, all those things are present. Tunica media is very thin and consists of few layers of smooth muscle only. Okay, इसमें elastic fibers नहीं रहता है, it's not present. Tunica adventitia in case of vein, medium sized vein is also thick. Okay. Now, thick layer of connective tissue containing collagen and elastic fibers. Example, as you can see, radial vein, tibial vein, popliteal vein, etc. Now, there is a speciality in case of medium sized vein. Okay, can you tell me the speciality? The speciality is inside the medium sized vein, valves are present. Okay, you have studied the lower limb. In lower limb, have you studied the venous drainage of lower limb? I know you have studied the venous drainage of lower limb. Okay? So what is the most important clinical significance of that venous drainage of the lower limb? Varicose vein. So क्या होता है varicose vein? What happens? Why? Because of the incompetency of the valves which are present in the vein. Okay, because that valves which are present, they supports the column of blood and they confirms the unidirectional flow of blood. Okay, because it has to go against the gravity. The blood has to flow against the gravity. Okay, that's why valves are present, and those particular valves are mainly present in the medium sized vein. Example, tibial vein, femoral vein, popliteal vein. These are nothing but the examples of medium sized vein. Okay, inside that, in the lumen which is there, in that lumen, valves are present. These are made up of a cusp, okay, lined by endothelial tissue. Okay, so venous valves are more common in the veins of lower limb, okay, so that it can send the blood against the gravity. Okay, so here you can see the medium sized vein. So in case of medium sized vein, tunica media intima is there. See, this is the tunica intima where the endothelium is present. Then see, tunica media is very thin, and just see the thickness of the tunica adventitia. Okay, next, here the valves which are present, okay, closing and opening of the valves are taking place, which will confirm the unidirectional flow of blood. Now here you can see the diagram of the large vein. So this the drawable diagram. Okay, this diagram you have to draw. Okay, now you can see tunica intima, endothelium, basal lamina, subendothelial connective tissue, few smooth muscle cells. All those things are visible in case of large vein. tunica media relatively thinner as compared to the tunica adventitia. Few smooth muscle, fibroblast and collagen fibers are present. In case of tunica adventitia, see, this is the thickness of the tunica adventitia. Okay, where longitudinal smooth muscles, few elastic fibers and bundles of collagen fibers are seen. Okay, longitudinal smooth muscles are there, bundles of collagen fibers and few elastic fibers are seen. Okay, see, this is nothing but the tunica adventitia in case of large vein. Okay, so vein may be two things, small or venules cannot be seen under this particular microscope. So medium size vein and large vein that can be seen, that you have to identify. Okay, so for that ये वाला, ये longitudinal smooth muscles are there. Amount of smooth muscles are more in veins, especially in case of the tunica adventitia, and along with that you are getting this particular elastic fibers and collagen fibers. Okay, and please keep that in mind, जहाँ पे ये elastic fiber collagen fibers रहता है वहाँ पे fibroblast रहेगा, because those are the cells which are producing those fibers. ठीक है, now this is the difference between the artery and vein. Okay, till now whatever we have discussed, here you can see the difference. All the layers are mentioned, what is present in arteries, what are present in veins. Okay, as you can see over here.